So guys, okay, now we'll go through from the rapid review, high yield system. Okay, so that is a part one. Okay, what are the classic presentation? Here you can see that, okay, so gout, intellectual disability, self-mutilating behavior in a boy. That is a Leishman syndrome. It is X-linked recessive disorder. Okay, mnemonic is given in first aid HGPRT. Hyperuricemia, gout, okay, pissed off, and then is the retardation like that. And remember, self-mutilation behavior is also given in Fragile X syndrome and borderline personality disorder. So that is Leigh-Mills syndrome. Next is the situs inversus, okay, chronic airway air infection, sinusitis, bronchitis, infertility. Okay, that is the primary ciliary dyskinesia or called Tagner syndrome. Dynan arm defect affecting the cilia. Here remember, okay, here I will cover this presentation. Also, I will give you other differential. So be aware of them. You can even write. Here you can write in the book on the side which are other diseases in which you will have. Here you can write on this point. Here write in the book DD, differential diagnosis. In this case, okay, it is the okay cystic fibrosis in which you can have chronic airway infection, sinusitis, bronchitis, infertility. Okay, in cystic fibrosis you can have both symptoms. So what are the differential point? In cystic fibrosis, okay, you will have pancreatitis and you will have growth retardation. But in Contagner syndrome, you will have situs inversus. Heart will be on the right side, okay, dextrocardia. And second, you will have growth will be normal. Developmental issue will be not present. Okay, so that is Contagner syndrome. In Contagner syndrome, screening test is the decrease nasal and O. Okay, while in the case of the cystic fibrosis, you will use the activated aminoreactive trypsinogen. Okay, either you can use the sweat chloride test. Okay, like that. So that are the difference between them. Next is blue sclera. Okay, sclera mnemonic is given in the book bite. Blue sclera, multiple fracture, dental problem, conducting hair loss. That is osteogenesis imperfecta. It is type 1 pleasant effect. What is the differential with them? It is the child abuse, in which you can have multiple fracture. Okay, but in child abuse, okay, you will have okay clinical history will be given. Okay, write down in the book. Differential is with child abuse. Next is elastic skin. Okay, hypermobile joint, increased bleeding tendency. Okay, bleeding tendency, hypermobile joint. That is a Ehlers-Danlos syndrome, type 5 collagen defect. Type 3 collagen defect seen in vascular type. In that case, you will have, okay, you can have aortic aneurysm, aortic dissection. Okay, you can have aneurysm in any your vessel, and you can have uterus rupture. Okay, like that. That is type 3. What is the differential? Okay, it can be Marfan syndrome. In Marfan syndrome, you can have hypermobile joint. Okay, so you can remember there are seven type of Ehlers-Danlos syndrome. Okay, type 3, type 5, classic type. Okay, like that. Okay, remember. And next is the, okay, archanodactyly, lens dislocation, upward and temporal, aortic dissection, hyperflexible joint. Okay, that is a Marfan syndrome. It is fibrillar defect. Mnemonic is given of F, okay, TGF beta, okay, chromosome 15, okay, fibrillin, like that. Most common cause of death is the aortic dissection. You will also have mitral valve prolapse. You will have chest, okay, chest defect like, okay, chest can be dipped downward and, okay, that is called, you know, pigeon type chest. Okay, so that are also given. You will have large height. Okay, you will have like more arm to a lower or limb ratio. Height will be more than 6 feet, like that. So that is Marfan syndrome. Marfanoid habitus is also given in men 2B, multiple endocrine neoplasia type 2B. Also, it is given in homocystinuria. So these height finding, these morphinoid habit is given to homocystinuria. Also, there is a man to be multiple endo endocrine neoplasia to be. In that, you can also have morphinoid habitus. Okay, so the typical height will be high. Okay, proximal arm will be more. Okay, so like that. Here you will have retinopathy, pectus deformity, lens dislocation. In this case, lens dislocation will be downward, so that is homocystinuria. But in homocystinuria, classic point is you will have increased risk of thrombosis. Okay, and you will have neuronal issue will be given. But in Marfan syndrome, no neuronal issue, no development delay, and you will have no risk of thrombosis. So that is the difference between them. Okay, then is a cephalot spot unilateral. Okay, polyostic fibrosis dysplasia, Purkish puberty, multiple endocrine abnormality. That is McCune-Albright syndrome. Here you will have GS protein activating mutation. Here you can make the mnemonic. Okay, 3B. Okay, spot, you can say pot, polyostic fibrosis, Purkish puberty, and protein issue. And remember, cephalot spot is also given in NF1, neurofibromatosis type 1, also given in the Fanconi anemia. Okay, done. Then is a meconium ileus in neonate, recurrent pulmonary infection, nasal polyp, pancreatic insufficiency, infertility, subfertility, that is cystic fibrosis. Classic point is pancreatic insufficiency. Otherwise, other finding also given in the bronchitis. So CFTR is GN issue. Then is calf pseudo hypertrophy. Okay, calf is replaced by, here you will have fibrofatty replacement of muscle. You will have muscular necrosis. You will have muscular dystrophy. Most commonly Duchenne due to X-linked recessive frame shift mutation of dystrophin gene. So you will have myonecrosis. Muscle will be replaced by fibrofat. That is child use arm to stand up. Okay, that is a okay. And there's a Gover sign that is for Duchenne muscular dystrophy. Okay. Then slow progressive muscular weakness in boy, it is Becker muscular dystrophy. Okay, we are done. So okay,